The success of the vaccination programme has made it possible to consider lifting the COVID restrictions at an earlier stage, according to one of the government's scientific advisers. Professor Mark Woolhouse of the University of Edinburgh told a parliamentary committee at Westminster that there were reasons to be more optimistic because there was more confidence in the scientific data compared to last year. But other government advisers sounded a far more cautious note, and the Prime Minister, Boris Johnson, said he was taking a data, not dates approach, which would go in stages. He's set to announce his plans next Monday for easing the lockdown in England. Our health editor, Hugh Pym, has the latest.
It'll be one of the most difficult decisions he has to make, at what speed to start easing the lockdown in England. The Prime Minister's hoping the rapid rollout of vaccinations will help for his plan to be unveiled on Monday.
It'll be based firmly on a cautious and prudent approach to coming out of lockdown in such a way as to be irreversible.
So what do experts think about when restrictions will ease? Schools in England could start reopening in 2.5 weeks' time, but families and businesses want to know what else might open up and when. Today, one expert was optimistic based on vaccine numbers and falling cases.
My conclusion from that is if you're driven by the data and not by dates, right now you should be looking at earlier unlocking because the data is so good.
You're muted.
And speaking to the same Commons committee, another scientist was also upbeat.
I think if we're cautious, we should get, it won't be completely normal, but things will start to look much more normal by spring.
MPs were also told scenes like this on some British beaches last summer were not the problem some people thought.
There was an outcry about this. There were no outbreaks linked to crowded beaches. There's never been a COVID-19 outbreak linked to a beach ever, anywhere in the world.
The number of daily reported cases was very low last summer. Then it picked up in the autumn and really surged in January to reach a peak before falling back sharply. But there's still a lot of pressure on the NHS. The number of patients in hospitals on ventilators is still only just below the peak last April. And that's even with doctors less inclined to use ventilators for patients this time. So how much can vaccinations help? There's agreement that the programme has gone very well so far, but there was a warning there was a lot more work to do to ensure sufficient community protection.
Don't unlock too fast, because if you unlock a lot, whilst a lot of the most vulnerable are still unvaccinated, genuinely we risk disaster, frankly.
And what role is there for mass testing? There's been talk of lateral flow kits giving rapid results being sent out to households and workplaces as lockdown is eased, but there was a note of caution about their use.
Where we've used them most successfully, I have to say, is where they've been self-tests, but in a semi-supervised environment. So there's somebody there to take the results, you log the result, you know who's had what test.
The Scottish Government will next week announce its plan for moving out of lockdown. The First Minister said a sharp fall in deaths amongst the over 85s in recent weeks was the first hard evidence of the positive impact of vaccination. Hugh Pym, BBC News.
Now, in the first trial of its kind in the world, dozens of young and healthy volunteers, all carefully selected between 18 and 30 years of age, will be exposed to the coronavirus in a safe, controlled environment. The study will begin in the UK in a matter of weeks, following approval from the clinical trials ethics body. And scientists hope it'll give them a deeper understanding of the virus. Our medical editor, Fergus Walsh, has more analysis.
This is where trial volunteers will spend just over 2 weeks in ensuite rooms at the top of the Royal Free Hospital in North London. There's quite a view and all meals provided, but the stay includes being deliberately infected with coronavirus. The aim is to find the smallest possible dose that will trigger an infection.
We believe the risk on this trial is incredibly small because they are young, healthy adults. Most of them will even be asymptomatic, but we're doing everything we can to make sure we're monitoring it and mitigating it.
Future trials will be used for head-to-head comparisons between different vaccines and how well they work. But this initial study should also yield important information about COVID.
In no other kind of study can you understand what's happening right at the beginning of the infection, how much virus comes out of people's noses, and most importantly, amongst asymptomatic people who we think are an important contributor to transmission in the community.
The volunteers who do spend 17 days here at the Royal Free Hospital and attend their follow-up blood tests over the course of a year will be compensated to the tune of £4,500. But it's altruism rather than money that seems to be the main motivation. Alistair is 18 and has already signed up. He's been campaigning for the trials to take place as a means of speeding up research into vaccines and the virus.
I think challenge trials are really, they are going to shorten the pandemic. Absolutely anything that we can do to shorten the pandemic is so unbelievably worth doing. So it's kind of, I guess it's that which is really driving it.
Challenge trials have a long history. In this study in Oxford, volunteers drank a solution laced with typhoid bacteria to test whether a vaccine they'd had protected them. It's an approach that should help find new COVID vaccines and treatments in years to come. Fergus Walsh, BBC News.
Let's have a look at the latest official figures now then. They show that there were 12,780 new infections recorded in the latest 24-hour period. An average of 12,289 new cases were recorded per day in the past week. And just over 21,000 people are in hospital with coronavirus across the UK. In the last 24 hours, 738 deaths have been recorded. That's people who died within 28 days of a positive COVID test. That number is almost a third lower than at this time last week. On average, 583 deaths were announced every day in the past week, and the total number of people who've died is 118,933. A look at the vaccinations, because almost 365,000 people had their first dose of one of the 3 approved vaccines in the latest 24-hour period. And that means just under 16 million people have now had their first jab. Let's go live to Westminster, talk to our Deputy Political Editor, Vicky Young. The Prime Minister today, Vicky, saying that this is all about data. And we heard one of the experts there saying the data is looking rather good as far as he's concerned. So where does that leave Mr Johnson?
Well, I think every time he gets in front of the camera, you hear the word caution, don't you? And I think there's an awful lot of expectation management going on, because they're really trying to balance the very good news about this vaccination programme alongside the idea that you unlock too quickly. So what they're talking about here is reopening in stages. We know schools will be at the beginning of that process, hospitality likely to be at the end. But I think what's interesting is that's in the short term, if you like, but ministers also in Whitehall discussing the longer term, some other issues really of how we live with coronavirus for quite some time. That could mean that mass testing is with us for some months, if not years, in schools, in workplaces. But there's ethical issues that they're wrestling with too. What if an employer says that everyone who works for them has to have a vaccination? How might people be able to prove that they've been vaccinated in order to travel? All of that is in the longer term, but no doubt about it, Boris Johnson wants to be cautious. That approach is going to irritate many people, including some of his own MPs, but I don't think he's going to change his mind.
Vicky, many thanks again. Vicky Young there for us with the latest at Westminster.